Hello everyone. I'm going to share a few ideas about national health policy. So, India had two national health policies earlier: National Health Policy of 1983 and National Health Policy of 2002. They have served well in guiding the approach for health sector in 5-year plans. Now, 14 years after the National Health Policy of 2002, now we have National Health Policy of 2017 coming up. In the backdrop of National Health Policy of 2017, uh, government has observed four major changes in the context. The first one will be the healthcare priorities are changing for the public, which needs a change in the policy, obviously. Although maternal and child mortality care have rapidly declined, there is a growing burden on the account of non-communicable diseases and some other infectious diseases that has to be addressed. The other important change is the emergence of robust healthcare techniques, most of which India has adapted, and so the policy change needs to be in line with them. The third change will be the growing incidences of catastrophic expenditure to the households actually. So due to healthcare costs, so this has to be definitely addressed. Our will talk briefly about it later. And then the fourth will be a rising economic growth that enables enhanced capacity for us to provide better healthcare. So these are the four causes, and let's talk about catastrophic expenditures in healthcare and the India's healthcare history. So one of the main concerns in developing countries is always the provision of healthcare. It has historically been a change for any government to decide the right amount of financing, the method for delivery of healthcare. Based on the World Bank data till 2014, we see that Indian government spends 4.68 percentage of its GDP, up from 4.2 percentage it used to spend in 2000s towards healthcare, which is in par with the standards of South Asia, but it's very way less than the world average. The world average in this case is 9.94 percentage of the GDP. When there is only one question on whether the spending is enough or not, another question is to see whether this will be able to make any improvements in the household spending of healthcare. I mean, whether it will be able to aid or support the catastrophic spending, whether it will be able to avoid it is a question. One of the World Bank reports on Indian healthcare also states that out-of-pocket household expenditure on households like due to healthcare is one of the main reasons of poverty actually. So that has to be noted. So incidence of these expenditures can be seen in every household. Every time an incidence of healthcare occurs, there are different choices left with the head of the household or with the members of the household who's going to make that decision. So they have to make a choice on the ways of seeking cure, all of which requires to spend differently. So the ways of seeking cure can be either they can go to public care hospitals or for private hospitals based on their illnesses, and based on their requirement of illness they can either go to inpatient care or outpatient care. This decision is sometimes made by the consulting doctor. The decision about government financing and delivery will ideally be based on the above consumption side factor. So as you know, the demand has to be met by the suppliers, so the consumer determine the demand here. So even the healthcare market is a little bit different and off seasonal, or it is, you approach a healthcare only when you are required, so you will not have a trend in demand changes in healthcare. So that way healthcare is a different commodity than the other commodities that we treat in economics. In terms of financing, the government has to decide whether partially or to completely cover the household out of pocket expenditure, whether the coverage should be provided only for amount spent on inpatient care or also to the amount spent on outpatient care. The government should also need to decide whether the direct method of aiding the diagnosis and treatment procedures or indirect methods of spending in nutrition hygiene when it comes to healthcare delivery. So when these are the issues in government to decide, so this policy making, this national health policy 2017 comes at a crucial time, and the decision that it makes is very crucial for the whole country, and especially for the households which have this catastrophic household spending. The primary aim of the national health policy 2017 is to inform, clarify and strengthen and also prioritize the role of government in shaping the health system in all its dimensions. investments in health, organization of healthcare services, prevention of diseases, and promotion of good healthcare. Um, through through all the sections of the society, across all the sections of the society, and access to technologies, developing human resources, encouraging local pluralism, building knowledge base, developing better financial protection strategies, strengthening regulation and health assurances. So these are the main objectives of this National Health Policy 2017, and the policy is formulated based on them. Let's hope this policy will achieve what it promises. Thank you.